Good morning. Welcome to Focus Richmond. It is my pleasure this morning to have Jennie Draper. She is a doctor, an OBGYN at Virginia Physicians for Women. Good morning, dear.
Hi, good morning. Thank you, Lori, for having me.
Sure. Okay, this morning we're going to discuss the subject that a lot of people don't talk about, but we should call menopause. Ladies, we all go through this. And I think the thing that we have to realize is that society would love to overlook it, but I love the fact that we're now talking about menopause and the changes that we all go through. Virginia Physicians for Women's teaming up with Fettle and Fit, their physical therapy, to empower women in our area who are going through menopause. There's a big event coming up on March the 4th. Dr. Draper, tell me a little bit about it.
Yes, so Casey is the owner at Fettle and Fit. We share a lot of patients together and had wanted to feature this new documentary that recently came out on PBS.
Right.
The documentary is called The M Factor, Shredding the Silence on Menopause. And by offering it to the community in this event on March 4th at the Science Museum, we are then going to feature a question and answer panel discussion afterwards with several other women's health experts so we can really get more conversation going around this topic.
That's excellent. So tell me a little bit about the M Factor. Obviously, it's about menopause.
Yes, it's all about menopause, very science-based, and getting really helpful information out to the public. There's so much noise around menopause, especially with social media, and we want to feature actual facts and get good information on how to manage this time in life for women. So this documentary was started by a journalist in New York when she went through her own menopause experience and realized no one was talking about it. And so as she discussed this more with her friends, came up with this idea to feature women's experiences, which are all really unique going through this phase of life.
Again, and that's the one thing people have to realize is it literally is different for everyone. I mean, your experience could be completely different from your mother's, your best friends, your coworkers, even your mom's experience, right?
Yes, and we're finding, or at least, I talk to women all day long about their menopause journey. And I think some of the generations above ours just didn't have this conversation. So now as women are starting to go through menopause, are realizing they really didn't learn about it and they didn't know what to expect, or that it impacted so many different symptoms. It's not necessarily just hot flashes, but it constitutes so many other things going on and start a lot earlier than what I think people expect.
Right. And there are actually surgeries that can put women into menopause sooner, correct?
Yes. And that was my own personal journey, actually. And even as a physician and having learned about this topic during school, I've learned so much more having had my own experience. But yes, if somebody went through surgery and had their ovaries removed because they were preventing a cancer or they had cancer, that will put them in what's called surgical menopause. So that's instant. Some women also experience that if they've had chemotherapy that may cause egg quality decline. And then other women go through it as a more natural progression of our reproductive health in the next phase as, again, our hormones decline as our egg quality decreases.
And so, I mean, I know this is a really difficult question to answer, but when typically does menopause start happening? I mean, what age should we start looking for that and perimenopause and that type of thing?
Right. So typically sometime in our 40s is the classic presentation.
Right.
We define the average age of menopause happens around the age of 51, somewhere between 51 and 52. But we define being postmenopausal once you've gone 1 year without a period.
Right.
However, you don't know when that last period is going to be. So everything that sort of precedes that is perimenopause. And then for women who had their uterus removed with a hysterectomy, or they had an endometrial ablation, or use some type of birth control where they don't get a period, they won't necessarily know that perfect timing. So we just have to sort of expect it and know what kind of constellation of symptoms to look for. And we start treating things way before your period would have disappeared.
Okay, because it's a lot about the fluctuation of the hormones, right?
Right. That's what makes perimenopause so tricky and everyone also experiences it really differently. There's some women that really don't have much fanfare about their symptoms. They kind of go through this natural progression and don't have a lot of complaints about it.
Right.
And other women, it's very dramatic. I describe it as almost like a roller coaster. So during perimenopause, 1 month, your hormones may be somewhat normal for what they've always been each month with your periods. And then the next month, they've dropped dramatically and you have sudden hot flashes and night sweats and difficulty sleeping.
Right.
And so from month to month, it can be really unpredictable. And that can last for 2 to 8 years before you're in this postmenopausal state.
Crazy. What are some of and I know brain fog, because I did have that. What are some of the other symptoms
Yes.
of being perimenopausal going before you get to the postmenopausal part?
The hot flashes, night sweats. Sometimes women don't perceive to have night sweats, but just know that they're running a little hotter and are waking up frequently at night.
Right.
And then that really causes a cascade of symptoms too, because if you're not sleeping, you don't feel well, and then you can't think straight either.
Right.
Brain fog is a definite complaint. Fatigue, weight gain, and also just weight changes where women will start noticing the shape of their abdomen changes. And that, of course, is really bothersome. And then certainly vaginal dryness, which then causes discomfort with intercourse, change in libido, thinning hair, dry skin, mood swings, heart palpitations. I mean, it's not an exciting time.
Right. It is a roller coaster of
treatment
craziness.
options.
Right. And that's the thing is too,
Yes.
is you and I
Yes.
we can talk about this because I know with my mother, there really weren't conversations. Generally you think hot flashes and that type of thing is all that's really going on. But now there's actually ways to relieve a lot of these symptoms.
Right. Yes. And there was also research that made women nervous about going on what we call hormone replacement therapy.
Right.
And now all of the data coming out and the message we're trying to get to women is there are safe options for treatment. So traditional hormone therapy is FDA approved. We like to start it before this postmenopause time period because it's most helpful and is also protective of heart and brain function, helps reduce the risk of osteoporosis when we initiate it as this transition happens.
Okay, let's talk. And a lot of people know this. I'm a breast cancer survivor and a uterine cancer survivor. So there is no estrogen in this body. I cannot have it. So what are the options that are safe for people like myself who've gone through cancer?
Right. There are other treatment options. There is a FDA-approved prescription now called Veoza, which is non-hormonal, helps with hot flashes and night sweats. They even had big commercials featured in last year's Super Bowl.
Right.
So we know that we've really gotten the conversation started when it's present at the Super Bowl.
Right.
But there are also other prescription medications. We will use mood stabilizers like Zoloft, Prozac, Lexapro, that category of medications. That will also help with hot flashes, night sweats, and certainly with the mood instability that happens when your hormones are all over the place. So there's so many options and it's very individualized. And so I just encourage women to come meet one of us that loves talking about menopause to get help and find the right tweaking of options to make you feel better.
Right. And there are, obviously some lifestyle changes you can make also, correct?
Yes. The more focused on the pillars of lifestyle medicine, where we're talking about sleep hygiene, eating right, increased protein, really watching added sugar in your diet, exercise, especially strength training, decreasing substance use like smoking and alcohol, it really makes a huge difference, not only in how mentally you feel, but will help reduce the hot flashes and help with body composition changes.
And that's the wonderful thing. And I will tell you this as a person who's now postmenopausal. If you talk to your doctor, talk constantly, have conversations. This doesn't have to be miserable. And that's the wonderful thing now
Right.
is that, you just talk to your doctors. Hey, this is because I remember early on for me, I had to go on some mood stabilizers or whatever. And then eventually I was off of that. And then there are just different things that it literally is a roller coaster, but it's a roller coaster you don't have to ride alone, which is so wonderful, right? Because now there are doctors like you who will talk to us about it. Do you know what I mean?
Yes. And then also, I think there's still less understanding that I wish there was about the systemic sort of side effects and how we manage that.
Right.
And then also a big focus about the vaginal dryness that really interferes with people's sexual health and how they feel there too, and plays a role with how their bladder functions. And so women can be on systemic hormone replacement therapy. So estrogen comes in a pill, a patch, or a gel, and also do vaginal estrogen, which is because so little of the vaginal estrogen is absorbed, that
Right.
can still be a safe option for breast cancer survivors.
Yeah, I call it the Pez dispenser. Just, sorry, ladies, but that's what I call it. So yeah, we gotta laugh about
Yes,
this,
but you got to talk about it.
right?
Yes,
Right.
and I think being like patient with the process and knowing like it's not going to get all fixed overnight, and
Right.
sometimes it is a trial and an error. I see my patients every couple months, so we can make tweaks as we need to and adjust hormone doses. And as this process goes, you have to tweak things to find the right balance.
Right.
But the goal is you should be able to feel well during this process.
Exactly. And here's the thing. This is why I love this event that's coming up to actually screen the movie. But then there's actually going to be a panel discussion time, correct?
Yes, we're really excited to offer that. So people who will be on the panel, my VPFW partner, Dr. Emily Stone, she is a certified menopause practitioner, so she is going to be on the panel. We will also have Casey Smith, the owner of Fettle and Fit, who is a pelvic floor physical therapist. We send tons of patients to her to help with pain during intercourse that can be a result of these menopause changes. And then we will also have LaShawn Dozier, who is a licensed professional counselor at Whole Journey Wellness, who's going to talk about the mental health aspects of menopause. And then Victoria Thompson, who's a naturopathic doctor at Richmond Natural Medicine, to talk a lot about the lifestyle medicine piece of managing menopause and what supplements can help in that angle.
This is awesome. It is really great. Now, the event's taking place March the 4th at the Dome Room of the Science Museum of Virginia, correct?
Yes, and it's going to be at the IMAX Theater. We think it's just such a cool venue so that people can really make a night of it with their friends. We'll have snacks, and then afterwards we're going to have this panel discussion and open-ended questions to really make people feel comfortable and seen and know that they are not alone in this journey.
Oh, I absolutely love this. It's just so empowering for women to have all the information, the knowledge, get the answers about menopause and perimenopause. This is going to be a great event.
Yes, we are really excited to host, and you can log on to our Virginia Physicians for Women webpage to find information regarding tickets.
Excellent. And also, they did give me the information on the Eventbrite one too. So you can go to vpfw.com, grab all the info there, and you can go to menopauserva.eventbrite.com. And the tickets are like $20, right?
Yes, $20. And the event will be March 4th from 6 o'clock to 8:30 in the evening.
Excellent. I am so excited you guys are doing this. I am one of those women who believes that we as women have to look out for each other, and we ultimately have to be our own advocates. Do not, and I'm going to take over for a second, do not ever miss your mammogram. Do not ever miss your annual appointment. And if somebody ever tells you you don't need a mammogram, you can tell them I said go to hell. So what I'm going to make sure you, yeah, I love insurance companies. What I want you to do, ladies, is that's the first part. I want to make sure you're always, VPFW has like offices everywhere. Get to your doctor. Don't put this off. This is not something you should be doing. But secondly, man, check out this event. This is going to be just so empowering and just give you so much information. Even if you're just in the front end of this or on the back end of this journey, this is going to be a wonderful event. Again, it's March the 4th. It's going to be the Science Museum of Virginia. You can grab all the information at vpfw.com. Okay, I'm sorry, I hijacked it there for a second. But Dr. Draper, is there anything else you want folks to know?
No, I think this is great. We're just really excited to host this unique event in Richmond, and we are happy to serve you as OBGYNs at our practice and get the help and the answers you're looking for. And, please, like you said, with the mammograms every year, we still want to see patients yearly for their physicals and their women health physicals. And don't put that off, and don't wait for the next annual appointment to feel better. I think I have a lot of patients that haven't been in and have kind of saved up all of these questions. Make a visit, make just a menopause consultation visit so we can go over what's happening with you and get you help much sooner than, waiting a whole year. You deserve to feel better.
Right. And again, if we get into incontinence and pelvic floor and just there's so many ways that you can receive help. You don't have to walk around feeling uncomfortable or not knowing or just go. I mean, I'm like you. You don't have to go annually. Just, there's you guys have so many great locations. There's probably one near your work or near your home or whatever. VPFW.com. Ladies, we are the ones who are like taking care of the world. So let's take care of each other. That's my theory.
Yes.
Well, I appreciate you spending some time with us this morning.
Thank you so much, Lori. This was great fun.
Good. And everyone else, thanks for spending time with us here this morning on Focus Richmond.